Hello and welcome to the Sound Health Network's webinar series. I'm Indre Viscontis. I'm your host and moderator for today. The Sound Health Network is led by co-directors Julene Johnson and Charles Lim, who also wrote our intro music, and music therapist Sheri Robb and I round out the leadership team. Our mission is to promote research and public awareness about the impact of music on health and wellness. The Sound Health Network is a partnership of the National Endowment for the Arts with the University of California, San Francisco, in collaboration with the National Institutes of Health, the John F. Kennedy Center for the Performing Arts, and Renee Fleming. This webinar series will feature interdisciplinary conversations between researchers and other stakeholders in our community, representing diverse perspectives and addressing obstacles that stand in the way of our mission. This week, we're going to discuss the use of music therapy in the management of cancer symptoms, especially in children. If you missed it, we featured the story of Issa, who benefited from a music intervention when she was undergoing cancer treatment in our monthly newsletter. So let's meet our panelists. Jefri Franks is a mother and music therapy advocate who experienced firsthand the power of music during her daughter's treatment of cancer. Welcome, Jefri.
Hello.
Dr. Sheri Robb is a co-investigator at the Sound Health Network, and she is a board-certified music therapist with degrees in music therapy and early childhood special education. Dr. Robb's program of research focuses on the development and testing of music therapy and music-based interventions to manage distress and improve positive health outcomes in children and adolescents with cancer and their caregivers. Welcome, Sheri.
Hi, good to be here.
And Dr. Steven Holochwost is a developmental psychologist and an associate professor of psychology at Lehman College at the City University of New York, where he co-directs the Research on Advancing Equity in Children Through the Arts, or REACH Lab. His research aims to understand how poverty impacts child development and how programs that expand educational opportunities for children can mitigate those effects. He has also evaluated biomarkers in research on the efficacy of music therapy and is a composer. Welcome, Steven.
Thank you, Andre. Good to be here.
So I would like to start by having Jefri tell us about her experiences. So how did this journey begin for you?
Well, the journey began for me when my daughter Heather was diagnosed with non-Hodgkin's lymphoma when she was 11. And she had her cancer treatment at Children's Mercy here in Kansas City, Missouri. And while we were in the treatment phase, she had been seeing the music therapist probably daily during her hospital stays. And then we met Sheri and her team, and they asked us if we would be a part of a research project that they were doing, It was called the SMART Project. And the basis of the project was that Heather was asked to create a music video. And she was given a choice of 5 different popular songs at the time. And the one she chose happened to be one of her favorites. So that was a little plus. And she got to take the words of that song out and put in her own words. She was also told that she could write the video about any topic she wanted. And she chose to write it about her cancer journey. She was also given a camera and different materials to make pictures with and write and draw. And my husband and I went home and took pictures that she wanted us to take and to have in her music video. And the process, if I'm remembering, took at least a week, maybe 2. Am I right about that, Sheri?
Probably closer to 6 weeks, but it was like one meeting a week over 6 weeks. Yeah.
Gotcha. Okay. And so this was like a light in the middle of all the chaos going on in terms of being a cancer patient and a family dealing with cancer. And this was something that Heather could really get involved in, especially since she was director and producer of her own music video. She allowed my husband and I to sing on the video with her, which is wonderful because now we have her voice. And I noticed a lot of things happen with Heather when she started to do the project. I noticed that she became really involved in the project and thinking about what she wanted to do, what materials she wanted, what pictures she wanted, what words she wanted to use to express her feelings about her cancer journey. I saw her have energy that I hadn't seen in a really long time. I saw her have excitement. And this was kind of something that really gave her a sense of control and a sense of agency. When you're a cancer patient or family dealing with this, so much control is taken away from you. You are kind of at the beck and call of your disease and the treatments that go along with that. And so here was kind of an area of expression and freedom that Heather could enjoy and we could enjoy as well. I also noticed for myself that that ever-present sense of hypervigilance was lifted. I didn't have to keep my eyes and ears on her as intensely as I had been, because she was lost in the project. She was happy. She was creating. And for a little while, it was like she wasn't this cancer patient. She was this beautiful soul creating something. And so it gave not just Heather many things, but it gave us as a family many things as well.
So Sheri, can you tell me a little bit about how you started to become interested in this population and this kind of intervention?
Yeah, so very early on in my career as a clinical music therapist, I worked with pediatric burn patients, and I worked at Shriners Burns Hospital for Children, actually in Galveston. And those burn injuries were very significant. Most of our kids had 80 to 90% total body surface area burns, which meant that in addition to having a lot of pain, they were also going through a lot of challenges with changed self-image and appearance, and what are the long-term effects and trauma that come from that. And I worked with a lot of adolescents, and so part of that work was using songwriting as a way for them to talk about what they were going through. We would do it in groups because it also allowed them to see they weren't alone. in that journey. And and this was like in early 80s. We didn't have digital video at the time, but MTV was popular at the time, you know, just starting to come on the scene. And so we were using VHS recorders that were this big and trying to capture video images to go with their song as a way to augment it. So you know, much further down the line, when I ended up working with cancer patients, realized there was an opportunity to use these same types of experiences as a way for young people to have an outlet to talk about what's important to them. And then when you get to share a video, you don't have to keep repeating that story over and over. So I think that's probably where the origins of that particular study came from.
And so how do you convince a family that this is something that they should spend the time and effort doing? I mean, I can imagine it's overwhelming. I can imagine, you know, and so what do you say to them when you're trying to explain why they should participate?
Yeah, and I think that's a great question, because I think it's a different conversation if you're enrolling in a study versus someone coming in and offering you clinical bedside services, you know.
Mm-hmm.
Not that it's necessarily a go just because it's bedside clinical. I think part of it is it's always relational. It's having a conversation with people. This is what this is about. Would it be something that you're interested in? You know, when we talk with families who enroll in these types of trials, they tell us the reason why they say yes. The first reason they give isn't because it's going to be great for my kid, although they are hoping for that as well. It's because if there's anything I can do to make treatment and this experience better for other people like me, sign me up. So it's very altruistic. Why a lot of even the teenagers who consent for themselves, a lot of times it's I want to give back. So I think that has a lot to do with why they agree to do this type of research.
That's interesting, because sort of common sense would suggest that you don't want to add another burden to their plate, but maybe this is, you know, in fact, couching it as as part of a research project might even help people feel as if they are benefiting even more beyond their own personal benefits. Yeah. So that gets me to Steven. And so that, you know, the question I think a lot of people wonder is we've heard about the qualitative changes for the family, for the child, and in, you know, over the last few years, though, there's been more of a push for a quantitative or measurable or objective way of trying to demonstrate the benefits, particularly when it comes to an intervention that might cost money or, you know, require funding. So funders are very interested in metrics. So I'm wondering if you can speak a little bit, perhaps tell us sort of what some of the challenges have been and how what is your approach to working to solve them?
Sure. So I think that, you know, right off the bat, it's important to acknowledge that it's very difficult to quantify the results of an intervention that are that an intervention that's seeking to improve quality of life. You know, listening to Jefri's account of what she and her family went through and what the music therapy intervention meant for them. I don't know, even if you quite literally followed Jefri and her family around for the entire time that they were experiencing that therapy, that you would have captured everything that she just talked about, or captured it in ways that are amenable to quantification. You know, I do think, as you said, it's important for us to try, and certainly there have been a lot of people who have tried to quantify the benefits of these interventions in a number of different ways, looking at you know, self-report, affect, mood, clinical outcomes, you know, the list goes on and on. Some of the work that, you know, I've been fortunate enough to do with Sheri has been looking at biomarkers, and there are a number of advantages to that. They're readily quantifiable.
Well, let's just tell people who might not know what a biomarker is.
Sure. So a biomarker is something that is a marker for some underlying neurological, neurophysiological, or biological process. And so you can have hypotheses about what the effects of a particular intervention are going to be, and you may hypothesize that some of those effects are going to be manifest at different levels of organization, so affect or mood, but that some of those may in turn be reflected at other levels of organization, such as neurophysiological function, for example. So in the work that Sheri and I have done, we've been looking at biomarkers, and in particular, biomarkers of immune function, but also biomarkers of hypothalamic pituitary adrenal axis function. So the hypothalamic pituitary adrenal axis, or the HPA axis, is a set of neuroendocrine structures that produce ultimately a hormone that is sometimes referred to as the stress hormone, although that's a little bit overly broad, but stress hormone called cortisol. And so you would expect, for example, that a music therapeutic intervention that had some of the effects that Jefri was describing for her child and her family might be reflected in lower levels of stress. And you could assess that through a questionnaire that kind of said, how stressed are you feeling today? But you also might look at it by measuring cortisol and saying, well, do we see systematic variations in levels of cortisol that correspond to the experience of the intervention? So it's a promising approach. It's also an approach that is not without considerable challenges, as we, I don't want to say discovered, because I think we kind of anticipated a number of them, but experienced in our work together. Depending on the aspect of HPA axis activity that you are interested in, it can require pretty frequent measurement. So if you're, for example, interested in diurnal function, that is the activity of the HPA axis over the day, you need to collect measurement over the course of the day, and collect measures of cortisol over the course of the day. And one of the advantages of cortisol is that it's sequestered in saliva, so you can get at that in a very non-invasive way. But I think a lot of our kids and families reported a yuck factor, for lack of a better word, about being asked to passively drool, as the euphemism goes, into a vial for us to have sample to then go assay. And one of the things that we encountered, again, this is something we knew was going to happen, is that depending on the type of cancer in which you're interested, these aren't cancers that occur with a great deal of frequency, particularly in young children, which was the age range for our current study. And so, on the one hand, that's a good thing from kind of a humanistic standpoint, but on the other hand, it does lead to certain challenges. And in fact, in our kind of pilot work, led us to employ a single case, which is a little bit of a misnomer, single group design, which was necessary because we just knew at the outset we were never going to, at least in the scope of the pilot work, get to a sample where we could run kind of parametrics or conventional kind of statistical tests. And I think there are also challenges for interpretation of the findings. I think what interests me a lot is what may drive individual differences in the efficacy of these interventions for different children and families. And I think the reality is that there's so much going on, again, as Jefri was alluding to, in terms of everyone's illness is different, everyone's course of treatment is different, and then everyone's circumstances are different when they arrive for treatment, that I think kind of wrapping your arms around all those variables and hoping to be able to measure them all in a sample that's large enough to let you kind of systematically investigate which of those variables seem to be leading to different treatment effects, on the one hand is very exciting, on the other hand is quite daunting.
Yeah, I imagine, there's so much variability, as you mentioned, just even in the experience of the child, let alone their family circumstances and, the treatment and so forth. And there's also a huge variety of things that you could measure, since we know that these kinds of interventions can impact a lot of different aspects of, our lives. So I guess, Sheri, my question would be to you is, when you're thinking about designing one of these evaluative studies, can you describe kind of your top 3 sort of priorities, or that you think of that are really important to hit? Because of course it's never going to be a perfect study unless you can literally spend 100 years studying, 1 million patients, right? So how do you prioritize, like what you're going to focus on versus what control you're going to give up?
Yeah, because these are clinical intervention studies that are, so when we talk about labs, you talk about controlled space where you can control as many external variables as possible. And we're working in a clinical setting, and clinical settings are messy. And so I think from a methods perspective, a design perspective for these types of studies, I think my first top pick is that the intervention design, what it is that how you're choosing to apply music for a specific outcome, needs to be very theoretically driven and scientifically justified. So based on the evidence that we currently have, what's my rationale for why I would expect songwriting and video production to improve outcomes on the back end? In our case, these were positive coping, very specific coping outcomes, or adjustment outcomes in the back end. My second choice is that we need to follow some pretty strong guidelines for what's called intervention fidelity or treatment fidelity. And a lot of times the thing that rings true with most people is when you think about fidelity, like quality assurance monitoring. So how do we know at the end of the study that any benefits that Heather had from that intervention were due to the intervention and not something else, or some other thing that the therapist did during the session that wasn't songwriting and, video production? And so some things that people aren't aware of is that actually fidelity, in addition to that, also involves some pretty rigorous elements of design, like we talked about, that has to be theoretically driven, but that we're monitoring to make sure things are happening consistently across patients and consistently across therapists who are delivering it, and then also how we collect the data. So I think that would be my number 2 thing.
So, I mean, it sounds like what you're really building on is a wealth of experience of having done the intervention first, so that you even get a sense of where to begin to look. That seems to be a really kind of important feature of eventually how you're going to be able to design the intervention, or design the efficacy study, which feels, from my perspective as a cognitive neuroscientist, kind of, we do the opposite, right? We start with, piloting, figuring out, and then once eventually we create an intervention or we think about it that way, that you start with figuring out what effect it will have on behavior, and then you can build it out. So is that, do you think that that's a feature of music therapy in particular, because music has so many different variables associated with whether or not it is effective? I mean, music is subjective, whether it's participatory or whether you're passively listening makes a huge difference. Is it specific to music, or do you think it's more like a part of just any kind of intervention that has this kind of real strong participatory aspect from the patient?
Yeah, I don't think it's necessarily different than other behavioral interventions. So that was a really interesting point you made about top down versus bottom up. I think right now what we're advocating for is that you come at it from all sides. So you're taking the clinical practice wisdom of people that are working out, because I mean, even medicine, as much as we want to say that medicine is objective and data driven, They're working from a certain set of data of best available evidence, and that's their starting point. And then when it doesn't work, they've got to figure out, okay, what do I try next? And they're constantly, but they don't know everything. They're just doing it. But that's their clinical practice wisdom feeding into the science piece of their training and working to do that. Music therapists, psychologists, the same. That's evidence-based practice. So they bring their clinical practice wisdom to work with families like Jefri and with Heather, and they learn a lot from them. And then we have people who are doing amazing research on how does music affect the brain? How does it affect us? Sociologists that are looking at music from a psychological perspective or a sociological perspective. So how do we bring all of that, all those fields of science, they're all meaningful to inform, the development of meaningful interventions and then the testing of them. And I think that that's where we get the best rigor in developing and testing things. And why do we care? Who cares? So you get some outcomes on the back end. Do we really need that, or do we just say this is great for people, so let's just do it? And I would say that the benefit of the science is that it helps us learn what works and what doesn't work and for whom, and that allows us to just do that work even better, which is why families enroll in the trials. It's like, I want to help you to do that job better.
Mm-hmm. So Jefri, as you're listening to, Sheri and Steven talk about this process, is there anything that comes to mind from your own experience that you would like to share where you might be able to help inform their decision making? Is there can you point to a particular utility of your experience that you feel like, there's this one thing that, I've never quite figured out how to talk about, but it was a really key, important thing for my daughter or for your family. Anything like that come to mind?
Yeah. First of all, I wanted to validate what Sheri had said about why families participate. That was certainly our feeling, was that, oh yeah, we could be part of a study that will possibly help other people that are going to come down this road behind us. And that's a very important thing. It also is kind of taking the attention off of you for a while and, off of Heather for a while. When you're in this scenario, there's just attention on you all the time, all day long. And so it's nice to think about, we could be a part of offering something to someone else. So not only hopefully is it going to help you, but it feels good to think about, this is something that we could be a part of giving to somebody else. And another thing I've been thinking as I've been listening is how the thread of music kind of went through this whole experience for me. After Heather died and I went back to work, my work meant that I had to go in and out of different hospitals. And as you can imagine, that was a little bit triggering. And so when I was on the highway in between hospitals, I would call my sister-in-law, and she worked in the mental health field, and she would sing this little song to me. It was a child's song, and it was called Start from the Very Beginning. And she would sing it to me, and then eventually we would sing it together while I was driving down the road. And it really helped me feel grounded and kind of get my stuff back together so that I could go and do the next thing. Another thing that really strikes me is all of the different songs that played while she was ill and after she died, and the impact of that music, and hearing that music and having it take me back to a particular time. And even though it was an extremely difficult time, there is also something good about going back to those times. Also, when I need to, I'm quite a few years down the road now, and when I need to kind of dump that grief bucket, I go to music to help me do that. I know particular songs that I can play that will, help me empty that grief bucket so that I can keep going forward. And just seeing the rooms had big windows in the doors, and when we would just see the music therapy cart coming to the room, I can't tell you what a relief it was, because typically it's a doctor coming, it's a nurse coming, it's a specialist coming, and there's potentially bad news. When it was the music cart, it was time to relax, and it was time to put your guard down for a little bit. Recently, also, I ran across an article, and it was about, I think it was titled Words Left Unsaid. And it was a family that had gone through pediatric cancer, and particularly the siblings were saying that after their sibling died, they felt that there was so much they hadn't said. And I'm thinking about these music interventions and thinking back on Heather making the music video, and what a catalyst that can be to allow you to drop down to that vulnerable place where you might be able to talk about some of those things. I can, Heather was an only child, but I can imagine a sibling possibly saying, when you wrote that line, what did you mean? Or, was that about this? Or, being able to inquire about what did those things mean to you? And I can see some extremely fruitful conversations coming out of that.
Yeah, I mean, I think we're starting to accept more and more that just music is a primal human form of communication, but even also a way for us to understand our own feelings and what we are going through, what we're thinking. I'm working on a couple episodes now for a podcast on music in prisons, and what I hear from the people who are incarcerated is that, in a place where they lose their dignity, where they have no control, where they actually have to sort of leave their bodies essentially in order to survive. They have to sort of separate from their consciousness in order to get through this. That music is a way of rediscovering even how they feel when they've had to numb themselves. So yeah, I think that that's really an important area for us to understand better what kind, because I'm sure it's not just listening to music, right? There's an element of actually making music that seems to be critical for those benefits.
Yeah.
But there's also a fairly now growing body of literature of the effects of music, whether I think in most cases it's participatory. Like I'm thinking of a study of individuals who had cancer, who were adults, who were singing, and how that impacted their immune system function. So, Steven, I'm wondering if you can tell us a little bit about, in cancer in particular, what are some of the, is it cortisol? Is it the stress response? Or are there direct measures of immune system function that we can think about or point to, or maybe try to measure to get some of these effects that, maybe help the efficacy of the treatment the person is undergoing when it comes to essentially immune disease, which is cancer?
Yeah. Well, I think that we're looking at cortisol in our study in large part because, going back to something that Sheri said earlier, it I think is very clearly related to some of the outcomes that have been observed in previous work with her music therapy program in particular, and then also other music therapy programs. So it makes sense, but there's no, I don't think you'd want to kind of claim primacy for cortisol is the biomarker that you'd be interested in. I think you would want it to reflect what your questions were. I mean, at one point when we were thinking about what we were going to look at in not only the pilot study, but ultimately the larger study that it led into, I do work looking at parasympathetic nervous system function using cardiac measures. And of course, I was beating the drum for that because it could tell us something about how children, and if we could get parents hooked up to the monitors, why not? Parents as well might engage differentially with the therapeutic experience. And so that would be a way to get some kind of purchase on, again, thinking about those kind of individual differences of treatment effects, because not every child or parent might be equally engaged or engaged in the same way. And so that cardiac data as a biomarker could be of real interest. I think going to immune function, we're looking in our study at cytokines, I believe interleukin 6 and 12, I think. Don't quote me on that, because those are, again, the activity of the immune system that is indexed by those cytokines should be a mediating mechanism between the therapeutic experience and ultimately what we care most about, which are the clinical outcomes that are associated with the music therapy. So that's one way to do things, but it's not, I want to be careful about not asserting that it's the only way, because really, as the kind of methodological toolbox that we have at our disposal around biomarkers has continued to expand. And I think most importantly, the toolbox that, the portion of the toolbox that includes non-invasive or minimally invasive kind of measures, you can, generally speaking, think of more things that you'd want to collect than you probably are going to be able to collect in any individual study because of cost and just burden kind of constraints.
So measuring cytokines and maybe even cortisol sort of has in patients with cancer, you can have a direct idea of like how the intervention might influence their treatment. Of course, there are also lots of painful procedures that these kids have to endure on a day-to-day basis. And we know that music listening can have a somewhat analgesic effect. So Sheri, I'm wondering if you can give us an overview of the kinds of music-based interventions that might be helpful in oncology and in pediatric oncology in particular.
Yeah, so I think most of the time, as you would guess, depending on what it is you're trying to accomplish, what you're trying to do, drives how you choose to use the music. And so much like with pain or procedural pain, that's a very specific kind of pain. It's short-term, generally. And it's the way, when you think about mechanisms of pain, like what's contributing to the pain, is it emotional factors, prolonged, chronic, or is it short-lived? So if we're doing something like a port access or a needle stick, a lot of times if you can focus the child's attention, help regulate their breathing to move through that short-term experience, the mechanism of action there is probably attention regulation, and then physiologically structuring their breathing. And so you would want to use the music. Now, for an older child, I've had kids who can do some guided listening with relaxation strategies, and I've seen them go through some pretty painful things and they don't feel it. Little kids, attention regulation from a developmental perspective, they're not self-regulating it the same way that an adolescent would. So it might require more active engagement with the music that has some visual dimensions. When I worked in the tub room with kids who had very painful treatments, with little kids, it was bringing in instruments and letting them bang on drums and sing and redirect all of that anxiety so that they could rechannel and refocus. So it's so many drivers, right? Age, and what's the mechanism? It's attention regulation for a short-term painful thing. For a child that's living with sickle cell disease where they have chronic pain, it's constant, it's chronic. It's figuring out ways that you can give them strategies to help manage their attention, but in a different way of trying to reframe that experience. So it's going to take a different type of experience, but the mechanism is different.
And that really speaks to the importance of at least understanding where you think the effect will be, so that you can choose the correct biomarker if that's really what you're interested in, whether it's looking at or the clinical outcome, is it a reduction in pain meds, or time for the procedure to take, et cetera. I can imagine all of these are potential outcomes. So I want to let our listeners, watchers know that you can type questions in the Q&A section of the webinar. So if you look to the bottom of your screen, you should see a little Q&A icon. You can click on that and ask us questions, and I'll forward those questions along to our panelists. Jefri, I'm wondering if you have a wish list or one particular thing that you feel you really wish could have been made easier for you. I mean, I'm sure there are 1,000, but is there anything that you ever came across that you felt like, here's an opportunity for a place where an intervention would be really welcome, and one that you just didn't find?
That's a really good question. And as I've been listening to this little segment, I've been thinking we were so fortunate in that through Heather's 11 months of treatment for cancer, and of course there were a lot of blood draws and a lot of introduction of chemo and a lot of bone marrow biopsies and things like that. The pain management that she had was so effective. She was not in pain. I do want to mention, though, that I did see something that was new to the hospital at the time, and that was during one of Heather's bone marrow aspirations. They had on the exam table, it was a musical table. And so you could turn on music while the procedure was going on. And so we did that. And it was great. I mean, Heather was anesthetized and did not feel anything of the bone marrow biopsy. That's one thing I find that's great about pediatric cancer is that there's so much emphasis on pain management. And but yeah, I mean, I think that there are probably lots of ways to use music that are not being used right now. And I think that there are probably a lot of places where kids go for treatment that don't offer a lot in terms of music, and certainly could do that. And I know for us how important that was in many days that we were there.
So we have, thank you for sharing that. We have a question from our audience that as Sheri, you've been describing the many challenges and the many variables involved in music therapy. This person is asking, can you learn to become a music therapist even after you've had a different career? Because it seems like there's so many ways that you could be useful. So can you give advice to a person who maybe wants to get involved in this kind of clinical work? Maybe they're non-traditional in the sense that they've had a career elsewhere and now are looking for, what would you suggest?
Oh, absolutely. It's never too late. So in fact, a lot of if you're interested in a career in music therapy, a lot of university degree programs have what they call equivalency programs, and they're specifically designed for people who have had degrees in other fields, so that you can come in and usually they're focused in on taking the courses that maybe somebody at the entry level would need to take for their degree. in order to practice music therapy and sit for the board certification exam. So many different options for people who are interested in entering the field.
And Ruby asks, is there a place where these clinical research data are collected for clinicians in order to keep up with best practice? So I will say that is something that the Sound Health Network is working to provide. But if there's any other place, Sheri or Steven, if you want to jump in.
Yeah, I think journals, I'm going to let Steven, you were getting ready to say something. I'll just say there's journals. Usually these types of results are published in academic journals. More and more of them are becoming open access. The NIH has a website where you can look for, I'm trying to remember, it's escaping me, Andrea, you probably know, Pubmed, where you can go and you can find articles. But then there's also groups like Sound Health Network that are working to summarize data. There's something called Cochrane reviews. There's several good music intervention, music therapy Cochrane reviews that work to summarize the research that's out there. Steven, what were you going to suggest?
I was going to suggest PubMed, I mean, as the first kind of stop for folks who are interested, just because, you know, generally speaking, if it's published in a journal, it's behind a paywall. But if it's research that was funded by the National Institutes of Health, then it has to be made publicly available. And so that's a really great resource for people who are interested in kind of getting into the nitty gritty, if you will.
Is there an up-to-date version of, or is that, you know, which is what I guess a lot of physicians use when they're, you know, thinking about the current treatments for a particular, is there a kind of version of that, or do you think that music therapy would be sprinkled throughout? I don't know if you're familiar with up-to-date, but that might be another thing for us to look at. And this is certainly something that the Sound Health Network is working to provide. Pamela was a little distressed when I said, I think it was me, that hearing music had a somewhat analgesic effect. She plays the harp as a therapeutic musician, and she knows it's not just somewhat. And you're absolutely right, I misspoke. What I meant was if you're listening to, you know, an iPod, I guess the people don't use that anymore, on your phone, rather than, I think, a live music playing, as we talk about those variables, will have a much bigger, more significant effect, perhaps, than just listening to pre-recorded music. And that's another area, again, where I feel like, you know, we need to make a distinction between passively listening to music that, you know, is available on your phone versus being in the presence of someone who is playing music for you in the moment. Suzanne asks, could Dr. Robb speak about the major outcomes of her research?
Sure. So I think, you know, with the research trial that we did that was looking at songwriting and video production, major things that we've learned from that, it was a very large multi-site clinical trial that lasted for about 5 or 6 years. So what did we learn at the end was that we actually found that this experience did result in significant gains for adolescents and young adults in terms of positive forms of coping. What does that exactly mean? Well, based on the theoretical framework that we were studying, which is a positive health model, we know that people have what are called risk factors and protective factors that help them navigate and adjust to long-term illness. And some of the things that we were able to touch on through songwriting and video production, in addition to positive coping, are things like meaning making, making sense out of your cancer experience, and social connectedness. So the experience was a shared experience between, as Jefri mentioned, they're contributing images, there's conversations that are spurred as the person is making their project, as they're sharing it, as they're connecting with healthcare providers. So that social connection piece was one of the strong outcomes we had as a result, a more positive form of coping and some better adjustment on the back end. What's interesting is that it didn't necessarily reduce what we call defensive forms of coping. So it expanded the range of coping strategies that people had on that particular study. And then in the current trial that we're doing, which is really focused in on music-based play as a way to manage shared distress between parents and young children who are going through cancer treatment, we're still in the throes of analyzing the data from one of those trials, but we're really starting to figure out how that works. For whom does it work? So we're looking at different age ranges and predictors, like does higher levels of stress that people come into the experience predict whether they benefit? So we're hoping to have more outcomes to share for that study as well in the near future.
So Tony, who's also a board certified music therapist, is asking, they work using live music therapy during bone marrow biopsies, and asked whether there were any biomarkers that you could recommend that could potentially be useful as opposed to Likert type scale questionnaires or self-report. Bone marrow, live music therapy. Anything come to mind from either Sheri or Steven?
This sounds like a weaselly answer, and I apologize for that. But it really would depend on what the goals, I would say, of the therapy are in that context. I mean, I would imagine that there's certainly a pain kind of reduction aspect. And that's something that, in terms of like a biomarker for pain, we don't have time to get into that. I think there would be certainly probably a stress reduction goal, presumably. In that case, I think you would make the argument for cortisol. Cortisol is tricky because we, at Indiana University, we enjoy access to kind of in-house institute that does assaying. If you don't have access to that, you have to send the cortisol out to be assayed, which can be expensive. I think there is a lot though that can be done with hemodynamic measures, things like heart rate, cardiac output, blood pressure, those are all the cardiovascular system is very responsive to a lot of the kinds of things we're talking about, whether it's perceptions of pain or perceptions of stress. And so that might be a place to start. But again, I think it really does depend on what the goals of the particular therapeutic approach are.
Yeah, I think that really speaks to understanding sort of what are the problems with bone marrow. Is it the decreasing the pain that the patient is feeling? And in this case, I think Tony works with adults, so maybe the anesthetics are not as effective, or there's pain post biopsy. Or are there other clinical outcomes? So maybe that's a good way of working with the oncologist or the whoever they're involved in clinically, to ask them, like, how do you measure success on a biopsy? Is it the time it takes? Is it the amount that you get? And are there ways of looking at those kinds of measures that you could see and find an effect on?
Yeah, I'd be curious to know whether or not they're doing any sedation at all, or if this is no sedation and that's the music is taking the place of sedation. Because if there's no sedation for that, I'm wondering if the heart parameters that Steven was talking about, the cardiac, might be an option, because if they've got the patient already hooked up on monitors, there may be a way to capture that. The other issue with cancer patients is that their cancer treatment, as well as their disease, interfere with your ability to really look at cortisol, unless you've chosen very carefully a window in time where that's not going to interfere, which is a big part of our current trial. Like, there's one treatment period when we don't have to worry as much about that interference. But it's very difficult to be using cortisol. So I think the cardiac measures that you mentioned, Steven, is a great place to maybe start looking.
And another question is related to the cultural aspects of the work, the sensitivities that are involved as you're working with diverse families, and the subjectivity involved in music. Music can be culturally, there can be times in which music actually has negative effects because of people's associations and so forth. So I wonder, Sheri, if you can speak a little bit to how you navigate the cultural question, And a secondary question, if we have time for it, of course, is that we also know that there has been a lot of racial injustice when it comes to pain management. And so maybe this is specific to adults. I don't know the literature in children, but so is there, can you, I don't know if there's a way you could weave that in, but in the few minutes we have left, can we talk a little bit about the cultural challenges and perhaps even address some of the racial injustices?
Yeah, so I think that's very important to be thinking about. And I think we're putting a lot more thought into that than we have in past years. Even speaking to my work that we're doing with young children and music play interventions, of taking a closer look, because a lot of the younger children's rhyming literature is very deeply rooted in some very offensive things culturally, historically, that get passed down from generation to generation, and you don't even realize that that's what's embedded in some of those songs. So it's taking a pause, especially for people who have not grown up in that culture, who might be, they're like me, and that wasn't my cultural heritage, and I need to be very sensitive and aware of those things moving forward. Yes, and as far as pain, one of the things that is very important is that, for example, children and adults who are living with sickle cell disease, it's an understudied often disease, especially when we talk about psychosocial support and music therapy interventions. We do have some music therapy researchers that are doing some fantastic research, emerging research in sickle cell. But the approach for the use of music needs to be very culturally based, and it needs to take that into account. And we need to be, it's not a one size fits all. Uses of music are different, not just based on age, but also culture as well.
So we have another question, a couple of them actually, about more specific interventions for different populations, say people who are palliative, who are requiring palliative care, or with veterans. And we don't have time today to cover all the different options, but we encourage you to go to our website, soundhealth.ucsf.edu, where we have a clearinghouse where we're basically pulling together articles about all of the different ways in which music can impact our health and well-being, which is our mission. So we encourage you to take a look at that, and to note that every month we're going to be having a webinar like this on a different topic, and on a specific topic related to music and health and wellness. So please sign up for our newsletter so that you can be aware of when we have a webinar that might be particularly of interest to you. We're also following up each webinar a week later with a journal club, which is more a discussion of the research specifically. So if you're interested in this particular topic, please join us next week at noon Pacific time, 3 p.m. Eastern time, also on Wednesday, for a journal club that will be led by Steven, and he'll be talking about one of his papers on biomarkers. And so you can find information about that on our website and sign up under events for our journal club. So, and please, do sign up for our newsletter so that you can, keep being informed. There were a number of questions that we didn't get to, but I'd like to sort of ask sort of this question about familiar versus unfamiliar music. So someone was asking Jefri if music was something new to Heather, or whether it was something that she was always interested in, and what we think about the importance of familiar versus unfamiliar music. And Sheri, as you've talked about, there are cultural issues related to when you're choosing music, as it might not be familiar to some. So Jefri, let's just start with you telling us about Heather, and then if we have time, maybe we can address that question more generally.
Sure. Music was a big part of Heather's life. It was a big part of she and my dad, or her dad's life. We had it playing in the house a lot. She was oddly a reggae fan, and we were not. So we would allow her some reggae time, and then we would torture her with Johnny Lang. And so, yeah, it was a big part of her life. It was very familiar, and spoke to her, I think.
And when it comes to familiar versus unfamiliar, I think probably we've run out of time because I think that that is going to be specific to the type of intervention. There is a wide variety of interventions, whether they're music-based or music therapy. And I think that question is something that we are all thinking about. And there is no easy answer to whether familiar or unfamiliar music is better or worse, as we've talked about all of these variables. So thank you so much for joining us for this webinar. Thank you, Sheri, Jefri, and Steven, our panelists, for sharing your insights and experience. Again, join us next week at 12 p.m. PT, 3 p.m. ET for an in-depth discussion of a paper by Steven for our inaugural journal club. You don't have to be a researcher. You don't have to have any experience. Just come bring your curiosity. And if you are a researcher and you have specific questions, this is the place to bring them. To register or learn more about the Sound Health Network and to take advantage of the resources we offer, including the Clearinghouse, please visit our website, soundhealth.ucsf.edu. You can also engage with us through our social media accounts. We are at Sound Health on Twitter, Facebook, Instagram, and YouTube. See you all next week or next month. Thank you.